Hi, good afternoon, everybody. Apologies, I'm not there in person. I would have loved to be there, but I had some travel and couldn't make it today. I think happy to share uh, the journey Deep Tech has been going through, and then happy to take any questions you might have. Happy to see if any which way me or at Deep Tech we could support the budding entrepreneurs. So my name is Ajit, and I have been a tech entrepreneur for a while now. It's been, as you can see, I have a lot of black hair. I'm as young as you all. Been a while. I have been at entrepreneurship, and sorry, I think my screen. Somebody can enable the screen share. I would like to run through a presentation. Yeah, and it's been a while through entrepreneurship. I'm an active charter member from at TAI as well. I have been trying to see how I can spend some time supporting startups. In the Pune ecosystem and otherwise as well, actually. So happy to catch up with any one of you who would be interested to talk to me, and whatever support I can lend, I'll be very happy for that, actually. Yeah, so what I thought in about 15 odd minutes, give a quick introduction to deep tech and the journey of deep tech. And you would understand how we started off, what kind of work we are doing, and what are the challenges and opportunities in the space I'm working on. And I believe some of that might be relatable to the journeys you are having. As Dr. Apurva mentioned, it's been about 4 years actually. In fact, though the company was started in 2017, the first 1 year was largely research, market research actually. Uh, Around April 2017, this particular business idea came up through some discussions. Actually, I was uh, before I dive in, let me give a quick introduction. I have, as I was mentioning, I've been a tech entrepreneur. I did my graduation from IIT Kharagpur, and since then I worked with IT firm. It was 95, 96 for about a year and a half, and then I jumped into entrepreneurship. Started a company called Vertex Software, which was focused on the Japanese market, IT services in the Japanese market, and we grew to around 700 folks actually. And I was lucky to have good partners like Mitsui and others, equity partners in that venture. And eventually we exited to a Japanese company called NTT Data. We were a fully Japan market focused company, providing IT services, 700 employees, almost 200 spoke Japanese. So it was very Japan is a large market opportunity, but very, very challenging because of language hurdle, quality hurdle, productivity hurdles, and we somehow could build an interesting organization servicing Japanese market. Eventually, NT Data, which is Japan's largest IT services company, they acquired us. That has been my journey. After that, I started another venture and now into deep tech. Um, in 2017, I was in Tokyo and I happened to meet the global CTO of NTT Data in one of the meetings, and he talked about the upcoming opportunity in radiology AI. Radiology is basically medical imaging scans like X-rays, CT scans, MRIs. I'm sure each one of you would have taken some of these scans at some time in your life. And radiology AI is to how to make it automated, like how to autonomous radiology, how to we have autonomous cars, and how radiology can also become autonomous. As soon as you take a scan, the machine itself will print the report for you. You don't have to send the scan to radiologist. The radiologist looks at the scan and reports and sends the reports back to you. A lot of time goes in between. Whereas autonomous radiology has the opportunity to kind of automate the radiology process, and within minutes the reports can be printed. So that's the opportunity which he talked about. And after coming back from Japan, I met quite a few folks to understand this space. And one of the person I met was Dr. Amit, actually. But I remember I met almost 35 experts to understand if this is a good market opportunity. I met radiologists, I met AI experts, I met owners of hospitals and imaging centers and researchers. And in that, I could meet Dr. Amit, young guy. With He's a radiologist with about 15 plus years of practicing radiology experience, and had also written a lot of research papers in the space of radiology across several papers and publications and conferences. And we together decided, okay, let's start deep tech. Actually, we joined hands and we started the journey of deep tech. And it's been, since then, it's been about 3 years now. It has been an interesting journey. We are about 100 plus people today in Banir. And in the journey, a lot of we built a lot of good leadership team. Ashutosh, who is ex Microsoft, he joined us as CTO. Viraj, who is from University of California, Berkeley, joined us as chief data scientist. So a very solid team has got created, and we have been very lucky that we have been able to raise a good amount of funding from some excellent partners in India and abroad. Actually, very recently we closed a very fairly large amount of funding, Series A funding from Tata Capital. Earlier to that, NTT Data, the earlier company which had acquired my earlier firm, they invested, and there are quite a few others who have also invested in deep tech. So this is the journey we had actually in the recent times. Coming to the opportunity, as I was mentioning, autonomous driving, I'm sure each one of you would understand, has a huge global market opportunity actually, and there are many challenges, but it is a huge opportunity. And similarly, autonomous radiology is a has a huge global market opportunity actually, and you know that medical imaging scans, CT scans, MRIs, X-rays are taken globally, and if you are able to automate that process, then of reporting those scans, then it is a huge potential. And this opportunity is fueled by the fact that there is a huge shortfall of radiologists. In India, India is red in color. We have only about 12,000 radiologists servicing the population of 1.3 billion. So huge challenge, huge shortfall of radiologists. And because of that, many issues happen. Patients don't get care in time. And as a result, a lot of challenges could happen. But not only in developing countries like India, but even developed countries like UK, for example, or Japan, Australia, they also have a huge shortfall of radiologists. And hence, there is a huge opportunity to try to innovate through advanced technologies and see how we can improve productivity, improve quality, improve patient care through technology, actually. And AI has a huge potential in the healthcare space, and especially within the healthcare space, medical imaging is expected to be a large opportunity, actually. And it is expected to be a large multi-billion dollar opportunity, fast growing. But if you ask me what is the current status, at this point, there is not much adoption of AI in clinical practices and in radiology especially. And there are quite a few reasons for that. There would be more than 80 global startups who have been funded in this space, but hardly any adoption of AI in the clinical practices. And the key challenges are issues like reliability, solution reliability. A solution which is working on a hospital A might not work in hospital B actually. And this issue is called as model decay or data drift. Model works in one place, doesn't work in other place. That is one big solution. So how do we create reliable solutions? And to create reliable solution, which we need a lot of rich data coming from different types of machines, CT scanners, X-rays, different makers, different settings, different cohorts, different pathology representatives. So unless you have richness of data with you, it is very difficult to develop a reliable solution. So that's one top point of challenge today in terms of creating adoption. The other challenge is that it's a very vast area. Like if you look at lung alone will have so many different diseases. It will have pneumonia, it will have COVID, it has tuberculosis, and so on. So many actually. And AI product which is helping the radiologist find one disease is not sufficient. AI product should help the radiologist find all the potential diseases in a given organ. So a point solution is not sufficient. A full organ-based solution is required. It's a journey to be covered. And today we don't have a full-fledged organ-based solutions in place yet, actually. So that's one challenge from adoption perspective. And also workflow integration. Uh, Many many hospitals have existing solutions for radiologists to look at the scans and report the scans. And how do we integrate our AI into those solutions? There are existing solutions already in place in the hospital. And can we really integrate them? How do we integrate them? Radiologists don't want to look at two different screens. They want to look at the same screen actually. So all these challenges together, there is not much global adoption. But when we started 3, 4 years back, and we were latecomers in the industry. There were already like 80 startups at that time, and we were lucky that we could understand the challenges faced by these startups and devise a strategy which is going to circumvent the challenges they are facing actually. And we took a different strategy. I'll talk about that. And courtesy that today, in the last 3 years, we have built more than 200 customers. These are hospitals and imaging centers. And these customers are not only in India, but we have customers in Japan. Singapore government has adopted our platform today. And also we have customers in APAC region like Indonesia, Philippines, Mongolia, and few other countries actually. So a reasonably good amount of traction or adoption was enabled, is getting enabled. Apart from hospitals and imaging centers, even governments are our customers, and our solution is being used for public health screening to identify tuberculosis and COVID-like infections on chest X-rays, basically. So I'll talk a bit about that later. Yeah, and a good amount of work is happening. A good team has got created. We are extremely tech focused on R&D, have 7+ patents, and in the process have accumulated a huge amount of medical imaging data from a large source of customers, hospitals, and a fairly good amount of volume is getting processed in a commercial mode today. So, what is the difference? Why the competing firms are not able to break into adoption, and why we were able to break into adoption actually? And the reason this AI is a very so-called glamorous space, and developing AI components which can do magical things. Uh, it catches a lot of attention actually. So you have a chest X-ray, and on chest X-ray you automatically identify a pathology. Great, excellent actually. But is that really solution very reliable? Actually, is a question. And most companies start with the excitement of developing AI components, started developing AI components and taking them to the customers globally, and they realize that these AI models, though they are working in hospital A or hospital B from where they have data points, it doesn't work on hospital C or hospital D actually, and so on and so forth. And they couldn't find adoption. So what we did is, instead of trying to sell AI components to the customers, we developed a platform actually. I'll talk about the platform, and that platform basically creates value for radiologists here and now immediately. uh, it, it it helps them improve quality, it helps them improve productivity, helps them deliver better patient care. And AI is one component of the platform. It's not just AI. It's AI is just one important component. But enabling AI on the platform is it creates some magic. But the entire focus is not on AI. The focus is on how do we create productivity improvement, quality improvement. So the focus of the competing firms was more on the technology and the magic of the technology. The focus of deep tech was more on the customer as to how do we create value for the customer, and not necessarily on the technology or the focus on AI actually. And as a result of the platform approach, we have been able to make a good amount of adoption today. And I think also as a result, today we are getting a lot of data from many sources. Like 200 hospitals are using our solution today, and we get data points from 200 different hospitals. The richness of data we get on the platform is amazing, and that actually helps us to develop more robust or more reliable products. That's the difference of approach. The platform we have is a very interesting platform. When a scan comes in from the hospital, whenever a scan is taken in any hospital, it comes into the platform within about 3 to 5 minutes. It will be on the platform. As soon as it comes in, there are AI components will automatically triage the scan as normal scan or abnormal scan, if it is abnormal, critical or non-critical scan. And that really helps the radiologist because the radiologist doesn't know typically. The radiologist has about 10, 15 scans waiting in the work list, but which one is critical, which one requires fast reporting is not clear actually. And that is something which we build for the radiologist. So as soon as a scan comes in, you see a red mark or a green mark or orange mark on the scan indicating this scan is critical or not critical. We identify the pathology on the scan and the location of the pathology. We also create the clinical report automatically. And that's a big, so AI is here, but we also have smart technology which creates the clinical report. It takes the input from the AI output and creates a structured clinical report and quantified clinical report. So radiologist has to typically write this report. Now it's automatically created, saving a lot of time. So it is much better in quality. Also, it is quantified. So a disease size or a disease grade is automatically quantified, improving the quality of the report, and that really improves productivity for radiologists, and so on and so forth. Uh, and more importantly, creating the feedback loop. So whenever AI recommends a pathology A, and the doctor changes it to pathology B or says that no, pathology A, but with this grade and not this grade, then the AI engine gets a feedback automatically, and that helps in continual learning of the AI models and evolution of AI accuracy. Actually, so this is the platform we have created. If you go to our website, the www.deeptech.ai, you can self-register, log in, and play with the platform. You can actually play around with the platform, see how the platform functions. You can actually open scans, look how AI works. If you have a scan of yours, whatever scan you have, X-ray, CT, or MRI, you can load it and see how the functionality, how the AI functions actually. So do try that out. Go to the website, and as a result of this platform, we are able to improve productivity by several folds. And especially in India, radiologists are paid per scan. And if you are using our platform and your productivity is high, you'll obviously earn more money. So that's a big driver for adoption for the platform. Actually. Quality improvement, turnaround time improvement, and the feedback loop for the AI engine. So that's what the platform enables. We have AI components across several organs today, and it's a journey to be covered. I think we have a good coverage across lung area and certain coverage across the other areas. We're also covering different types of machines, modalities they are called. But it's a journey to be covered, and we continue to work on this journey and day in, day out, explore how we can add more components on the AI side, actually. And some of our AI components have been tested by WHO. And this is one such test where you can see 11 products were tested, and we came at the top. And our accuracy curve is this. And and this white dot is a human radiologist with about 5 years of experience. The black dot is a uh, is a is a radiologist with around 25 years of experience. And you can see Deep Tech's accuracy curve is not only better than many other products, but also better than humans actually. So our AI has already started delivering accuracies at par or better than human experts actually. So it's a continual process. We continue to work on it and continue to improve and innovate the technology. And the feedback loop especially helps us to grow the accuracy of our AI models. Actually. Being in India has been a big value. Being in Pune has been a big value for us. Getting medical data is not easy actually. In US or in other countries, if you go to a hospital and say, "Hey, can you share your data with us?" They will never share it actually. But thanks to uh, the ecosystem we have in Pune, even Pune University Vice Chancellor have been supporting us in some of the relationships, and we have been able to form these research and development associations with many hospitals in India, which has helped us get a lot of big data, so that really brings a huge competitive advantage. Also, many hospitals are very open to do research collaborations and help us with validation studies, actually, and that's very critical. So, in a very cost-effective way, we are able to validate our products in the hospitals. Also, access to medical doctors and AI experts is relatively much easier and cost-effective in Pune, in India, I would say. And then this I think is the core competence, and this platform has helped us build the business we have built today. Actually, yeah. So that's about deep tech. Yeah, thanks everybody. Um, And as I said, please do write to us if you have anything. This email address, the emails comes to me as well, and I'm happy to uh, address those mails and talk to you all whenever you feel like. Yeah. Thanks. If there are any questions, I'm happy to take them up.
Maybe Ajit, if you could also speak about why did the investors feel excited to invest in your company?
Yeah. No, yeah, absolutely. No, I think funding is an extremely important part of a startup journey. And nowadays, the first venture I started in 1996, I didn't take any funding at all. And I remember from the month one, I had to make sure the company is profitable. We couldn't have a situation where we burnt money. Today, we are lucky. There are investors available to support your ideas actually and help you loosen the belt a bit for first few years so that you can build a strong business actually. Now, funding, if you ask me what actually is very critical in raising funding is first is the vision. The vision has to be big actually. You have to be aiming to become a unicorn actually. You have to be targeting to become $1 billion plus company actually. You have to have a global vision actually. Unless you have a global vision, unless you have a target to become a unicorn, investors will not invest in you. Investors want to invest. It's a high risk investment. 99% startups are going to fail. So the investors want to invest in big vision actually. That's number one. Who is supporting the vision? How is the co-founder team actually? Are they capable enough? What track record they have? That's the second part of it. So if you're building your startup and you have a good vision, make sure you have a good team together actually. And third important thing is what is that you have done so far? What is your traction? Where have you reached in your journey? Your vision is great, but where have you reached today actually? And if you're able to address these three questions clearly and effectively, there's a lot of money there today in the market to be taken actually. It's not difficult to raise funding, I would say.
Great. I think there's a second speaker who is saying the same thing, that funding is available, but you really need to speak the language that the investor is really wanting to listen to. So, most sitting in this room are early stage startups. Anyone has any questions for Ajit? Yes, I know you will have a question. Please go ahead with your question. There's one question for you here.
Hello, sir.
Sure.
Uh, we are proposing a diagnostic kit actually, which is related to the MDR TB. So here we are targeting to have this rapid results. We already have this CB-NAT and the gene expert with us, which are telling us about the TB, but it is located at the district level and not at the point care facility. So the pregnancy test kit which we have. So similar to that, we are proposing a kit which will give us the rapid and the accurate result. For that, we are utilizing the CRISPR technology, if you might aware of it. So it is just the bacterial immunity with which the bacteria is going to fight with the virus. So we are utilizing that. So I would like to have your insights on this. We are stuck at the prototype stage because everything is related to the molecular biology, and we are from the pharmacy background. So I would like to have your take in this.
No, excellent actually. The area you're working on is a huge market.
Yeah.
And I think you're in the right country as well. As you
Yes.
know, in fact, COVID, in the first year of COVID, more people died because of tuberculosis
Right.
than
Right.
COVID actually. And the
Right.
burden, India has the highest burden of tuberculosis, and WHO has announced some $16 billion funding to support tuberculosis initiatives, and a lot of that coming to India. So I think the space you are in is a great space. The market, the vision, I would say, is a great vision. Uh, and as COVID is receding, we see a lot of government initiatives, not only in India, but across the world, actually, in Asia Pacific, in China, in Russia, South America, to speed up the tuberculosis elimination drive, actually. In fact, WHO has a goal to eliminate tuberculosis by 2030.
Yes. Yes.
And a lot of very aggressive funding is happening. the product you mentioned is a very, very interesting product actually. And if you can really develop that product, which is reliable, I think it will be it will have a magical adoption, I would say. As you know, gene expert tests and other
Yeah.
tests have a lot of challenges: machinery, equipment,
Right.
access, and cost. Actually,
Right.
and if you can develop a very cost-effective product like pregnancy test you mentioned, it will be amazing. So that if I look at this, the main question I would have is how is the reliability of your product actually, and if you can work on that, you can do some validation studies and publish those validation studies in good medical journals. I think you would have hit a very interesting milestones. And I think with the proof that your uh, kit is delivering fairly accurate results, I think high sensitivity, specificity might be low, it's okay, but sensitivity should be fairly high. I'm looking at say 95% sensitivity, 50% specificity. If that range you are able to hit, you have a winning product actually. It has
Okay.
global market opportunity.
Okay. So that means we have to first work on the R&D part of it.
Yeah, absolutely. Yeah.
So like how we can connect with those people, because we are also the students, and there are some points at which we need some molecular biology or some biotechnologist help.
I'm sure there
Right,
we can
right. No, I
chip in.
think
We can chip
yeah.
in and
Please go
help
ahead,
you and
Apurva
get
ma'am.
you connected to people like him and others in the domain. In the incubation center, that's the role, if we can help. And of course, time is precious for all of them also.
Yes, yes.
But we can definitely find some space. They'll find space for you and some experts. That's what I feel. Ajit, if you have any other thought on it, please kindly guide her.
No, no, absolutely, absolutely. I think you're in the right ecosystem, and I think university would have all the right connects for you. And also the government bodies, like government has
Yes.
established a very rigorous like execution mechanism in terms of central TB board, in terms of RNTCPs across India. And there are
Yes.
a lot of people doing activities in this space. So you just have to reach out, I think. And I think university would be the right place to start, I would say.
Okay. Thank you so much, ma'am. Thank you, sir.
I think she is really motivated today. She looks very happy.
Yeah.
I think with that, we come to the end of the session. Thank you so much, Ajit, for taking out time for us today from Bangalore, that you're able to come with us.